I get to do it because now I can use my arm and body to give a little bit of traction while they do that. Okay, so I'll give traction and I will play with that popliteus, and he doesn't like that. Yeah, for sure. Yeah, is that pretty deep? Yeah, for sure. So I'm just loosening up that popliteus. What does it do? Reminder.
Rotation.
Which direction? External rotation, right?
Like we literally just said it.
For sure. For sure. So I'll open up that popliteus just to loosen it up. And yes, it does bring it into external rotation. I just don't want it overactive and protecting. So I'm going to loosen up that hyperextension. Now I'm going to open up that popliteus and I'm going to give some traction. You feel that? Mm-hmm. Yeah. So now I'm just giving traction, and no, I'm not trying to reproduce the anterior compression. I'm trying to distract it and give it a little relief to let them know that it's okay to go in hyperextension again. Mm-hmm. More so than anything else, they're afraid of that same movement. Mm-hmm. And all I'm doing is repatterning that by decreasing the tension on that popliteus and giving traction at the same time. And they open it up. He is tough, man. Yeah, there is no contact area. This is straight like fingertip. Yeah. So I will open that up, loosen it up. And the same thing in gapping, especially with like Bella or anybody else ACL. I like the gapping technique in sitting. Yes, you don't get max knee flexion, but it's still something to help give some separation, some pain relief, okay? So if you see me do this, especially on a fresh knee or an ACL meniscus, if they're having pain pinchy, I'm gonna pull down, but I'm gonna wrap that leg down around it, right? And I'm gonna give them a little bit of traction. So I'm actually doing minimal with my hand. A lot of it is just coming down through my foot. You see what's happening here? Mm-hmm. And then I'm just pulling that down. You feel that? Mm-hmm. Yeah, that feels amazing on somebody who has knee trauma. Right. That feels amazing. And it's minimal work on my hand. So I have traction here. I have two opposing forces right there. That allows them to have a little relaxation, open up and gap. And then from here, you can soften that popliteus just to talk to them, see how they're doing. I'll work on the quad, make sure life is good, eye contact. I'll open up just a little bit of traction, then open them up here, finish off that popliteus, and then finish off with a little bit of hyperextension, tractioning, just to get some proprioception and calm down that last little bit, okay? So that'll help. You've got to train that hyperextension again, that it's not going to be painful. Next, now once they're comfortable with it, they're still not going to be having 100% comfort with weight bearing, and especially going hyperextension with it.